Have you been diagnosed with herniated disc? Are you being told that you need spinal surgery? You're probably scared and you do not want to have that surgery. Did you know that you have options to avoid surgery? Surgery should be your last option. I want to take a minute to go over what herniated disc looks like on MRI and give you an understanding what are your options besides surgery. So here we have a lumbar spine of abnormal and what normal is. In order to understand what abnormal is, we need to know what normal looks like. So from the side view of the lumbar spine MRI, we have a curve of the spine. That's number one thing that we need to pay attention to. Here inside, we have what's called spinal cord. In between the spinal cord, we have spinal fluid and looks white on MRI. In between each vertebra, we have spinal disc. A healthy spinal disc on MRI looks white. Why? Because the disc itself is 90% fluid. So when it's hydrated properly and there's no compression of any kind and the discs are moving, that's how they're going to look like. So here on the right side, we have abnormal of the lumbar spine MRI. So first thing we're looking at is there's no curve. It's completely straight. What's the problem of not having a curve? The reason why we do have a curve is to absorb gravity throughout the spine. When we lose that curve, all the pressure is on the last 2 or 3 discs. So what happens is whether it's through repetitive stress or car accident or any type of a trauma, so that disc gets compressed. So here what we're seeing is, if you can see all of these discs, number one, they're thin, right? 2, they are a lot darker. When they become darker, that means they are dehydrated. If they are dehydrated, that means they are weak in strength. So when they're weak, any type of compression will squeeze that disc. So what happens then, it starts to push out. If you can see that little bump over here, that's herniated disc. Sometimes it's protrusion. What it does is it compresses that spinal nerve or spinal cord. The symptoms that people have with that is either just pain, or it could have a radiating down the leg, which is called sciatic pain. So depending on the severity of the pain, people are ready to do anything that's possible to alleviate the pain. But when people jump on surgery, it's not a miracle type of a treatment. It comes with its own risks. If there is a need for surgery, then there will be the time for it, but it should not be your first option. So let's go over, we're gonna go over the cervical spine. This is a cervical spine MRI. This is normal, this is abnormal. Again, let's go over the normal. We're looking from the side view. Here we have the brain sits on top, the spinal cord passes through like this. We have a spine in the front. In between, we have spinal fluid that looks white again. This particular MRI does not show very well how hydrated the discs are. Like this one and this one is a lot lighter compared to these 3. Nevertheless, there is no compression. We do see a curve, which we want to see, but we do not see any bulging or herniations that compress the spine. So this person would not have any type of pain. So on this side, number one, we see no curve. The discs, certain discs are more compressed. And then we see it right here. This one right here is herniated or protruded, compressing that spinal cord or the nerve that can cause a lot of pain in the neck, or it could shoot down, depending which level it is. It could shoot down the arm. Again, surgery should be your last option. So what is that we do here in our office? So we do what's called advanced spinal decompression therapy. What does that involve? Spinal adjustments, shock wave, and spinal decompression therapy that decompresses the spine. So as always, getting an adjustment is creating mobility in the joints. It's not gonna bring that disc back inside. Once we get the joints adjusted and mobilized, then we're applying shockwave therapy. What is that doing? Shockwave is a sound wave that penetrates into your body that creates a fake type of stimulus or fake trauma that causes pain, that tells the brain something's going on in that area, we need to send blood flow. It also decreases inflammation, and it breaks down scar tissue. Very, very important that in order to heal, we need to break down the scar tissue to create mobility. And then after that, what we're doing is we're doing what's called spinal decompression therapy. What it does is when a person lays down, we put belts on the top of the spine and then belts on the lower spine. Our patients lay down, and the machine separates them, holds there for 30 seconds or so, and then releases. What we're doing with that is we're creating negative pressure in the spine so that the fluids can come in and come out. Remember, discs are avascular. They do not have blood flow that passes through in so freely. So we need to create that pumping motion that it can squeeze fluid from the vertebra above and below. So if you are experiencing any of these type of pain, if you've been diagnosed with MRI, we invite you for a consultation with us and see if we are your good option to alleviate not just your pain, but putting you back to things that you want to do and to better function.